Health Minister Professor Onyebuchi Chukwu says it is not true that the federal government has sacked resident doctors in the country's federal teaching hospitals. He said what the government did was to suspend a program that, in his words, was obviously not working. He was speaking after the weekly Federal Executive Council meeting. Take a listen to what he said.
They were not sacked. You see, it is all a matter of interpretation. Let me give you an example. Whether someone, while still working actively, let's say a civil servant who has been working actively dies while he's still working actively on active service, or whether that person resigned, or whether that person was dismissed, or whether that person was retired, or whether that person was terminated, they mean different things in public service. But actually the end point is that that person is no more working. I want us to put things in perspective. So government did not sack anybody. It is true that they themselves have not been working for almost 2 months now. Resident doctors working in government, except those working in private hospitals, resident doctors working in both federal and state hospitals, almost 2 months now, have not been working. They have not participated in the control of this Ebola virus disease. They've not played any role. Absolutely. So even if government had not taken any decision at all now, they are not working. They are not there. I don't know why suddenly the media starts taking interest in them. Were they working? They are not working. They are not part of this success story. But what happened was that it's like when the aviation industry, when you refuse after buying ticket to fly and you don't come, they say no show. You didn't show up and they even penalize you. So there's no show of the resident doctors. Now, even government is still paying them. And I know tomorrow, it's just that sometimes the media is not proactive. The people who are unemployed, even some doctors who say they are not employed, may be asking government a question. Okay, is it because we never had an appointment letter? What is the difference? You are paying people who are not working. We too are not working. Why are you not paying us? Sometimes we need to think deeply what we do to ourselves in this country. Okay, fine. So now government says within this period, we've been trying to see how to reorganize even residence period. It's okay, they are not there. Why can't we use this period to reappraise properly this program and come up with something that can help the country? Because training of a doctor, just like any profession, whether it's engineers or anything, people need to be trained properly.